Now we will discuss diameters of female pelvis. Pelvic diameters are critical measurements in obstetrics as they determine the capacity of the pelvis to allow passage of the fetus during childbirth. In other words, obstetric diameters are measurements of the female pelvis that are used to assess whether a woman can give birth vaginally. This slide shows the brief overview of pelvic diameters of inlet, cavity, and outlet. Now we will discuss anteroposterior and oblique and transverse diameters of pelvic inlet, pelvic cavity, and pelvic outlet separately. First, we will discuss about the pelvic brim or pelvic inlet diameters. Anteroposterior diameter of the pelvic inlet is measured from the upper inner border of the pubic symphysis to the sacral promontory, and it is measured as 11 cm. Oblique diameters of the pelvic inlet are right or left oblique. These are measured from the sacroiliac joint to the iliopectineal eminence, that is from the right or left sacroiliac joint to the right or left iliopectineal eminence, and it is measured as 12 cm. Transverse diameter is measured between the two widest points on the iliopectineal lines and is measured as the 13 cm. Now, pelvic cavity measurements are anteroposterior diameter is measured from the inner border of the pubic symphysis to the curve of the sacrum. It is measured as 12 cm. Right and left oblique diameters are measured as right and left sacroiliac joints fanning out to measure a point between the upper and lower pubic rami. It is also 12 cm. And transverse diameters are measured from the right inner surface of the ischium to the left inner surface of the ischium. It is also measured as 12 cm. Now, pelvic outlet measurements. Anteroposterior diameter of the pelvic outlet is measured from lower border of the pubic symphysis to sacrococcygeal joint, and it is measured as 13 cm. Oblique diameter of the pelvic outlet is measured from the sacrospinous ligament to the obturator foramen, and it is measured as 12 cm. Transverse diameter of the pelvic outlet is measured transversely from right to left ischial spines. It is measured as 11 cm. This slide shows the pelvic inlet boundaries and pelvic inlet bony landmarks. Boundaries of pelvic inlet are interiorly upper border of pubic symphysis, posteriorly sacral promontory, and laterally linea terminalis. Bony landmarks on pelvic brim or pelvic inlet separating the true pelvis from false pelvis are shown in numbers. Number 1 is pubic symphysis. Number 2 is pubic crest. Number 3 is pubic tubercle. Number 4 is pectineal line. Number 5 is iliopubic eminence. Number 6 is iliopectineal line. Number 7 sacroiliac articulation. Number 8 is interior border of ala of sacrum, and number 9 is sacral promontory. This slide shows diameters of pelvic inlet along with its measurement. Anteroposterior diameter, transverse diameter, oblique diameter, as I have already explained in previous slide. Anteroposterior diameter has further three diameters which are obstetrically important. These three diameters are true conjugate, obstetric conjugate, and diagonal conjugate. This slide shows the three obstetrically important anteroposterior diameters of the pelvic inlet along with its measurements. First is the true conjugate diameter, which is 11 cm, and it is measured as distance from the tip of sacral promontory to the upper border of the pubic symphysis, and it is anatomically important. Second is the obstetric conjugate diameter, which is 10.5 cm. It is measured as distance from the tip of the sacral promontory to the most prominent middle point on the posterior surface of the pubic symphysis. It is shortest anteroposterior diameter due to bulge on the posterior surface of pubic symphysis. It is clinically important through which fetus must pass during delivery. Third is the diagonal conjugate, which is 12 cm, and it is measured as distance from the tip of sacral promontory to the lower border of the pubic symphysis. It is clinically important because obstetric conjugate diameter can be calculated by subtracting 1.5 cm from the diagonal conjugate diameter. This slide shows the clinical measurement of diagonal conjugate. How to measure? Two fingers of gloved right hand are introduced into the vagina along the sacral curvature to reach the sacral promontory. In normal pelvis, it is usually not felt. The point where the bone recedes from the fingers is the sacral promontory. The radial border of the fingers are then mobilized underneath the pubic symphysis and a mark is made over the gloved index finger. The distance between the marking and the tip of middle finger is the measurement of diagonal conjugate. This slide shows the transverse and oblique diameters of pelvic inlet along with its measurements. Transverse diameter, which is measured as the distance between the two farthest points on the iliopectineal line, and it is the 13 cm. It lies 4 cm anterior to the sacral promontory and 7 cm behind the pubic symphysis. It is the largest diameter in the pelvis. It lies more closer to the sacrum, divides the brim into anterior and posterior segment. The head of the fetus negotiates the pelvic brim through this diameter. Oblique diameters are the right oblique diameter, which is 12 cm, and it is measured from the right sacroiliac joint to the left iliopectineal eminence. And second is the left oblique diameter, which is measured as 12 cm, and it is measured from the left sacroiliac joint to the right iliopectineal eminence. Oblique diameters, which is measured as 12 cm, refers to the right or left sacroiliac joint respectively. And third is the sacrocotyloid diameter, which is 9.5 cm, and it extends from the midpoint of the sacral promontory to the iliopectineal eminence. In flat pelvis, biparietal diameter occupies this diameter of inlet during delivery. This slide shows the pelvic cavity boundaries. What is pelvic cavity? Pelvic cavity is the segment of the pelvis bounded above by the pelvic inlet and below by the plane of least pelvic dimensions. It is almost round in shape. Boundaries of which are the roof is formed by the plane of pelvic brim and the floor is formed by the plane of least pelvic dimensions. Interiorly, it is bounded by the pubic symphysis. Posteriorly, it is bounded by the sacrum. Laterally, pubic bone, obturator fascia, ischial bone, and ischial spines. Diameters of the pelvic cavity, anteroposterior diameter, transverse diameter, and oblique diameter all are the 12 cm. What is mid pelvis? Mid pelvis is the narrow part of the pelvis measured at the level of the ischial spines, also called the mid plane or plane of least pelvic dimensions, and goal through mid pelvis is the internal rotation. This slide shows the diameters of pelvic cavity. Anteroposterior diameter, transverse diameter, and oblique diameter of the pelvic cavity are all 12 cm in measurement. Second figure shows the anteroposterior diameter of the pelvic cavity, which is 12 cm in measurement, and it is measured anteriorly from the midpoint on the posterior surface of the pubic symphysis to the junction of the second and third sacral vertebra posteriorly. This slide shows the boundaries of mid pelvis. What is mid pelvis? Mid pelvis is the narrow part of the pelvis measured at the level of ischial spines, also called the mid plane or plane of least pelvic dimensions. The mid pelvic plane extends from the lower margin of the pubic symphysis through the level of ischial spines to meet either the junction of the S4 or S5 or tip of the sacrum, depending upon the configuration of the sacrum. If plane meets the tip of the fifth sacrum, it coincides with the plane of least pelvic dimensions. If the plane meets the junction of the fourth and fifth sacral segment, the plane becomes the wedge posteriorly. Goal through the mid pelvis is the internal rotation, boundaries of which are: roof is formed by the plane of greatest pelvic dimension,
Floor is formed by the plane of the least pelvic dimension. Interiorly, mid-pelvis is bounded by the lower margin of the pubic symphysis. Posteriorly, it is bounded by the fourth and fifth sacral segments. Laterally, it is bounded by the ischial spines. This slide shows the diameters of mid-pelvis. Transverse diameter of mid-pelvis is the bispinous diameter, which is 10 cm. It is measured between the two ischial spines. Anteroposterior diameter of the mid-pelvis is measured 11.5 cm. It extends from the lower border of the pubic symphysis interiorly to the point on the sacrum at which mid-pelvic plane meets posteriorly. Posterior sagittal diameter, which is 4.5 cm. It extends from the midpoint of the bispinous diameter to the point on the sacrum at which mid-pelvic plane meets. Mid-pelvis is defined by the level of ischial spines. So anteroposterior diameter of the mid-pelvis is divided into anterior sagittal diameter and posterior sagittal diameter at the level of the ischial spines. The interior sagittal diameter of the mid-pelvis is measured from the inferior aspect of the pubic symphysis to the midpoint of the transverse diameter at the level of ischial spines, and it is considered as crucial measurement for assessing the adequacy of pelvic inlet for fetal passage. This slide shows the boundaries of pelvic outlet. Pelvic outlet is diamond shaped. It is bounded interiorly by the pubic arch, lower border of pubic symphysis. Posteriorly, pelvic outlet is bounded by coccyx. Laterally, pelvic outlet is bounded by ischial tuberosities. Anterolaterally, pelvic outlet is bounded by istiopubic rami, and posterolaterally, pelvic outlet is bounded by sacrotuberous ligaments. Anatomical outlet. Anatomical outlet consists of two triangles, anterior triangle and posterior triangle, with one base formed by the loin joining the ischial tuberosities, which is bituberous diameter. Anterior triangle, apex of the anterior triangle is at the lower border of the pubic symphysis, and the apex of the posterior triangle is the tip of coccyx. Diameters with plane of anatomical outlet. Anterior sagittal diameter is measured from the lower border of the pubic symphysis to the center of bituberous diameter, and it is 6 to 7 cm. Posterior sagittal diameter is measured from the tip of the sacrum to the center of bituberous diameter. Clinically, it is measured by the distance between sacrococcygeal joint and interior margin of the anus, and it is 7.5 to 10 cm in measurement. This slide shows what is obstetrical outlet and boundaries of obstetrical outlet. Obstetrical outlet is the space exists between the plane of anatomical outlet below and plane of least pelvic dimensions above is called the obstetrical outlet. It is the segment, the boundaries of which are roof is formed by the plane of least pelvic dimensions and floor is formed by the anatomical outlet. Interiorly, it is bounded by the lower border of pubic symphysis, and posteriorly it is bounded by the coccyx, and laterally it is bounded by the ischial spines. This slide shows the diameters of pelvic outlet. Anteroposterior diameter of the pelvic outlet is 13 cm, which is measured from the tip of the coccyx to the lower border of pubic symphysis. Obstetrical anteroposterior diameter is 11 cm, which is measured from the tip of the sacrum to the lower border of pubic symphysis as the coccyx pushed back by fetal head when passing through the introitus during the second stage of labor. Transverse diameter of the pelvic outlet is bituberous diameter, which is 11 cm, and it is measured between the inner aspects of the ischial tuberosities. This slide shows subpubic angle, pubic arch, and waist space of Morris. Subpubic angle is formed by approximation of the two descending pubic rami in normal female pelvis It measures 85 degrees. Pubic arch is formed by descending pubic rami of both sides, and it is of obstetric importance. Normally, it measures 6 cm in between the pubic rami at the level of 2 cm below the apex of the subpubic arch. Clinically, it is assessed by placing 3 fingers side by side. The narrower the pubic arch, the more is the fetal head displaced backward and the less room available for it. Normally, the subpubic arch is rounded and less space is wasted under the pubic symphysis. When a round disc of 9.3 cm diameter of well-flexed fetal head is placed under the arch, the distance between the pubic symphysis and circumference of the disc is measured. This measurement is called the waist space of Morris, and it should not exceed 1 cm in a normal pelvis, as shown in figure.
This slide shows the summary of diameters of the pelvic inlet. Three obstetrically important anteroposterior diameters are the true conjugate diameter, which is measured as 11 cm and it is anatomically important. Obstetric conjugate diameter, which is measured as 10 cm and it is shortest anteroposterior diameter through which fetus must pass during delivery. And the diagonal conjugate diameter, which is measured as the 12 cm and it is clinically important because obstetric conjugate can be calculated by subtracting 1.5 cm from this diameter.
Anteroposterior diameter of the pelvic cavity, which is 12 cm in measurement, and it is measured anteriorly from the midpoint on the posterior surface of the pubic symphysis to the junction of the second and third sacral vertebra posteriorly. Anteroposterior diameter of the mid pelvis is measured 11.5 cm. It extends from the lower border of the pubic symphysis interiorly to the point on the sacrum at which mid-pelvic plane meets posteriorly. Anteroposterior diameter of the pelvic outlet is 13 cm, which is measured from the tip of the coccyx to the lower border of pubic symphysis. Obstetrical anteroposterior diameter is 11 cm, which is measured from the tip of the sacrum to the lower border of pubic symphysis as the coccyx pushed back by fetal head when passing through the introitus during the second stage of labor. This slide shows the significance of ischial spines. Ischial spine is important because it is the narrowest plane in the pelvis, and this plane corresponds to the origin of the levator ani muscles, and it is also known as pelvic floor. During course of mechanism of labor, internal rotation of the fetal head takes place at the level of ischial spines. This level marks the beginning of the forward curve of the pelvic axis. Pudendal nerve hooks around the dorsal surface of the ischial spine and enters the perineal pouch. It is the landmark used for the pudendal nerve block analgesia. The bispinous diameter 10.5 cm. Distance between the tips of the two ischial spines is in this plane. Station of the presenting part is expressed in either minus or plus in relation to the ischial spines.